Small cell versus non-small cell lung carcinoma. So just before I start my presentation, today I'll give a broad overview of both small cell versus non-small cell carcinoma, and then I will go into the details about differences in each. Small cell lung carcinoma is closely associated with a history of smoking. It is highly malignant and is often identified in an already advanced stage, and for this reason the prognosis is usually worse. This cancer can respond to chemotherapy, however, it usually recurs. Non-small cell lung carcinoma is more common than small cell lung carcinoma. Now, there are three main types. There's squamous cell carcinoma, adenocarcinoma, as well as large cell lung cancer. Now, squamous cell carcinoma is also closely associated with smoking. So this leaves small cell lung carcinoma as well as squamous cell lung carcinoma as the two cancers which are most closely associated with smoking. Now, for these three main subtypes, treatments and prognosis are similar. However, they have different histological appearances. Now, let's have a closer look at the comparisons between these non-small cell lung carcinoma subtypes and small cell lung carcinoma. In terms of location, squamous cell carcinoma and small cell lung carcinoma are usually found centrally within the lung, as well as large cell, whereas adenocarcinoma classically is more likely to affect the outer parts of the lung. On initial presentation, squamous, small cell, and large cell carcinomas are more likely to be found as a small solid mass, whereas adenocarcinoma is distinct in that it can take on numerous forms such as papillary or acinar in a diffuse manner, or it can also present as a solid mass. Adenocarcinoma is also the slowest growing of the four types. Squamous cell carcinoma usually involves squamous cells. Surprise, surprise. But recall that these are those flat cells and they might be found surrounding the bronchus in this cancer. Adenocarcinoma commonly affects mucus-producing cells, and those are those cuboidal or columnar cells that we spoke about in anatomy. Large cell carcinoma affects large cells, but I didn't really find what that actually meant, and this might be because it's difficult to determine because of the lack of differentiation seen histologically. However, these cells typically have moderate cytoplasm and large nuclei and distinct nucleoli, which is that dark dot in the middle right there. And lastly, small cell lung carcinoma affects small cells, commonly white blood cells such as basophils seen here, which have large nucleoli and no nucleoli apparent, and very little cytoplasm. Interestingly, small cells are actually seen to be twice as large as a lymphocyte, so perhaps not so small after all. When examining the histological slides, you might see varying degrees of differentiation in squamous cell carcinoma, more glandular differentiation in adenocarcinoma, and very little differentiation in large cell lung carcinoma. In small cell lung carcinoma, you might see dense core granules owing to their neuroendocrine properties, which are traditionally used to help differentiate between small cell and non-small cell lung carcinoma. However, large cell lung carcinomas can also have neuroendocrine properties, so it's not really as specific. Other neuroendocrine properties might include neuron-specific enolase as well as synaptophysin. Key features which may help distinguish these carcinomas from each other include the presence of keratin and intracellular bridges. In addition, these squamous cell carcinomas can also secrete parathyroid hormone-related peptide, which might lead to hypercalcemia in that patient. %80 of adenocarcinomas contain mucin, which is a glycoprotein constituent of mucus. So in this picture on the left, you can see that the squamous cell carcinoma has keratinization which is characteristic of squamous cell carcinoma, as well and then on the right we see an adenocarcinoma, and you can see these cuboidal columnar cells, which are characteristic of adenocarcinomas. Large cell lung carcinomas are typically undifferentiated, and thus there are no real outlines histologically. And small cell lung carcinomas might secrete adenocorticotropic hormone, antidiuretic hormone, as well as gastrin-releasing peptide or calcitonin. Now I put in a few mutations for my interest really, but adenocarcinoma is distinct in that epidermal growth factor receptor and KRAS are activated in about 40% of these tumors. This can aid in targeting treatments to cancers with these characteristic mutations. Additionally, RB and P16 are cell cycle proteins, which would normally initiate mitosis when the cell is ready to divide. However, in many cancers, these proteins and others can be mutated, leading to a characteristic increased proliferation seen in cancer cells compared to normal cells. Lastly, non-small cell lung carcinomas are commonly treated with surgery with some radiation versus chemotherapy, as I mentioned earlier, for small cell lung cancer. And that's all. Thank you.